Project Access is a nonprofit that helps patients uninsured and underserved with access to medical care and services in our community. We're able to evolve depending on the need of the patient. So if a patient comes in with an urgent specialty care need and we connect them with resources, then we learn that the patient also needs child care, that they might also need to be connected with mental health resources, with legal resources. We really address all the barriers depending on the individual. So during the pandemic, the need just, now they didn't have access to public transportations, and they didn't have access to a taxi ride because they were symptomatic, so they couldn't get to the testing site, and they didn't know if they had COVID, and they had all the symptoms. We help patients that were at home with all their children, and they needed to make it to a doctor's appointment that they couldn't bring their kids with. So now all the complexity of, who can care for my child while I get access to my urgent appointment. Patients were getting the message about isolations and, quarantine, but then we're working with a population that they don't have 3, 4, 5 rooms or 2, 3 bathrooms. They have one bathroom that they share with 7, 10 people. So our role too as community health workers is to advocate for what we're seeing, what we're listening to, the stories. And then we work with the leadership, with the health department, with the hospitals, with shelters, and we pass on those stories, we pass on those needs. There's such a huge need that, you know, I wish one day that there is enough funding for that army of community health workers, because it's not just through the pandemic, but we will continue to see those gaps. Even for the aftermath of what COVID is causing, we have patients that need access to neurologists, cardiologists, all the aftermath of having COVID. The need, it will continue for the communities of, the underserved.